Hi everyone, welcome to our Vivace Microneedling live treatment here that we have at Alta Vista Dermatology right now. We are in the room with Alexa, one of our estheticians, and our lovely patient Jen. We're prepping her to have the treatment. We're doing this live because we have a current event going on right now. We just added the Vivace to our treatments and we are super excited about it. Vivace is the newest and hottest treatment in microneedling. It adds radio frequency, and I'll allow Alexa to talk about that a little bit more. But it is wonderful treatment for little downtime and great results. We currently have a special going on. It's our intro special. It is $450 per treatment with the purchase of a series of 3. We want you to get the best results possible. So we are super excited to be doing this and sharing this with you all, and certainly ask any questions that you might have. We've got an expert here who can answer those. And after the live video, if you have questions, please feel free to ask. We're happy to answer those after hours. So we're going to get started. I'm going to ask Alexa to share some information, and we're just super excited to be sharing this with each of you. So here we go. I am going to flip the camera to someone who's a little bit better at this than me. There's our Alexa and Jen.
Hi, everybody.
Hi. Okay, so Alexa, tell us a little bit about the Vivace treatment.
So Vivace is a microneedling with RF technology. It's this beautiful device right here. And it's microneedling, which creates little micro injuries within the skin to stimulate your own natural collagen. And then it delivers RF, which is radio frequency, to help with the skin tightening.
Oh, that's awesome. We are so excited to hear all about this.
Yay!
So is there...
I'm gonna go ahead and start.
Okay, go ahead.
So we do use a sterile needle tip, individual needle tip. To go ahead and put on. Perfect.
Okay, can you tell me a little bit, what did you do to prep this patient prior to the treatment?
So I usually ask the patient to come in 30 minutes prior to the treatment, and we put numbing cream on her so that she's not feeling really any of the needle punctures.
Okay, great. Well, we're going to let you get started
here.
Jen, have you had any microneedling treatments before?
I have, not with the RF technology.
Okay.
We're going to start at a little bit of a lower depth, needle depth here on the forehead. I always tend to go a little bit lower in depth so that on bony areas. And I'm going to start at the forehead. I'm going to work my way down your nose, above the lip to the chin, and then as I get into the cheek area, I am going to change my depth, okay?
Okay.
Let me know if it's too uncomfortable or if you have any questions for me.
Okay.
All right.
So I understand that a lot of people use microneedling maybe before an event. Is there any downtime with this? I know the Vivace probably goes a little bit deeper than a standard microneedling, correct?
It does, but you're controlling the depth by choosing what depth you want to go. But there is little to no downtime with this treatment, which you'll be able to see. I like to say immediately after the treatment, there's what is called the Cinderella effect. And that's because there's a little bit of inflammation, so it gives the skin a really nice glow. But typically you're only red for about 2 to 3 hours post-treatment.
Oh, that's great. I love the Cinderella effect.
And that Cinderella effect can last for up to 3 days.
So would you say it's good to do this treatment before an event? I know some laser treatments aren't, but what?
Absolutely. I've had a lot of patients come in prior to events because of that Cinderella effect. I would say definitely, you know, maybe 48 hours before your event is okay to do it.
Okay, great. So Jen here is prepping for a big day in May. She's getting married, so this is probably a good series for her to experience prior to her wedding, right?
Absolutely.
I love that.
How you feeling, Jen?
It feels fine.
Between 1 and 10, where would you say that sensation is right now?
2 or 3.
Great.
So I see she's got a little bit of pinpoint bleeding.
Which is very common, especially in these areas when you're on bone.
And you're pretty comfortable, Jen? No pain?
Nope, no pain.
Oh, that's wonderful. So she numbs for about 30 minutes with a topical numbing.
Correct. And then the treatment itself usually takes anywhere from 30 to 40 minutes, depending on how many passes we're going to do.
And passes means how many times you go over the skin.
The entire face, correct.
And Alexa, how many treatments do you suggest? I mean, I know some treatments people say, oh, you only need 1, but what do you suggest for the Vivace?
For Vivace, I typically recommend 3 treatments, 4 to 6 weeks apart, but also it depends on the patient's, the condition of their skin, to how many treatments I will actually recommend. So somebody who has, you know, more laxity within their skin, maybe some acne scarring, they may need more than 3 treatments.
No, you bring up a good point. So what type of skin conditions do you think this treatment works best with? Acne, scarring,
It
stretch
actually
marks?
works great for all skin types. Any patient that's dealing with acne scarring, even active acne, not severe active acne, but mild active acne, patients who just have some skin laxity, texture and tone issues, helps with fine lines, especially around the eyes and mouth.
That's great. Still feeling okay, Jen? Are you feeling any heat or discomfort?
No, there's a little bit of heat that I can feel as it's being pushed through the skin.
As it's being delivered.
Mm-hmm. That's good. It means it's working, right, Alexa?
Absolutely. We always want to feel a little something to make sure that it's working.
No pain, no gain.
No beauty pain, no beauty gain. And I always love to go right along the brow bone and then the upper eyelid as well.
And what does that do?
It gives a little lift to the brow.
And that's the RF part that gives
Correct.
the lift, right?
Creating that lift, yes.
So I know you mentioned the Cinderella effect, but after someone does a series, let's say they do a series of 3, when do you expect them to start seeing results? Will it be immediate or is it gradual over time?
It is actually gradual over time. Up to 3 months, they'll continue to see results after a series of treatments.
So it's kind of like the gift that keeps on giving.
Absolutely. How you doing?
Good.
A little bit more tender on that brow bone, isn't it?
Mm-hmm.
You're doing good.
So what other
Now,
areas?
Someone actually probably would not go directly on the upper lid or the actual brow bone, but she doesn't, so we're good.
And I love that. You're actually treating. There are so few modalities that allow you to treat the eyelid itself. So what is that doing to her upper eyelid as you're treating it?
It's just giving her a little lift to her brow.
That's great.
I'm going to go down your nose now.
And so the face is probably the most common area that you treat, but what other areas can you treat with the Vivace?
You can treat all areas of the body. We do a lot of treatment on the neck as well as the chest, the hands, and I've actually had a lot of requests and have treated the kneecaps as well. The area where we start getting a little bit of laxity right around the knee. This is a great treatment. Typically requires more treatments though than just 3 on that area.
Sure. Oh, I never even thought about that.
Yeah.
Maybe we should treat my knees.
Yes, let's do it. And again, the hands are a great area as well, where we tend to lose volume and get what I call crepey skin.
The hands tell the, what is that saying? The hands tell the true
age.
Yeah. We forget about our hands.
Very often. I actually like to combine microneedling with BBL, broadband light, so that you're treating pigmentation of the hands as well. And even sometimes I'll suggest for hands in particular, doing a series of the Vivace and then maybe a BBL and then having filler in your hands too.
Oh, that's a good idea. We lose volume very, very quickly in our hands. How you doing, Jen?
I'm doing great.
Good.
How are we doing around the eye here?
Good.
Everybody can use a little tightening around the eye.
So Alexa's actually been performing the Vivace for quite some time. She was one of the individuals that highly encouraged this procedure because she has seen such beautiful results with such little downtime, which is something we are all looking for. So Alexa, what do you love most about this treatment?
What I love the most about this treatment is it is a very effective treatment, but also there is no little to downtime with it. So patients are more apt to do it and do it more frequently because they don't have the downtime that comes with a lot of minimally invasive treatments.
It's so true. We're always fighting our schedules and so many events that it's nice to have a treatment that we don't have to take a week off from work, but we can still get results.
There's very few people that have time in their busy schedules to have a lot of downtime, so this is a great treatment.
Now, do you, for those nasty little smoker lines that we tend to get that are so stubborn, do you treat the upper lip commonly with this?
Absolutely. Some patients will request that they just have the treatment done around the mouth, but this particular needle tip is good through many, many passes. It doesn't wear out, so I can use this needle tip on multiple areas in one treatment.
Oh, wow.
So with that being said, I highly recommend not just treating around the mouth, treating the entire face or any other area that is of desire.
So what should someone expect, for example, Jen, over the next 24 hours? What should she expect?
So she'll be slightly pink for about 2 to 3 hours today, and possibly a little bit longer. It's always, I always say it's patient dependent. It depends on the individual. But then as tomorrow when she wakes up, she's gonna have a little bit of inflammation, which most people like because that does fill out the fine lines, wrinkles, and it gives a beautiful glow to the skin. She can go back to, putting some makeup on tomorrow, no problem. I would just have her avoid any active ingredients such as a retinoic acid, retin-A, even vitamin C for 24 hours. but most patients go back to their daily regimen within 24 to 48 hours post-treatment.
Oh, that's great. So immediate post-procedure, do you place anything on the skin?
Yes, I'll be applying a active serum, and then I apply a soothing mask that just really helps take down some of the inflammation, as well as helps to cut some of the redness. Plus, we've created thousands of little micro channels within the skin, so anything that you apply right after is going to have a greater ability to absorb and be more active.
It seems like you're getting through her face so quickly. How many passes do you think you'll be doing based on her skin type? And
I'll do at least 2. If she can handle 3, we might go 3.
She can handle it. She's tough.
Sure she can.
Did anyone have any questions out there?
Okay, we're going to stop for a moment, and I'm going to change the depth because we're going to start working on your cheek, and I'll have you tilt to the left.
So we actually started performing this procedure on some staff members. Many of you know very well our cosmetic patient coordinator, Brenda. So she is one person that we trial a lot of procedures on. She enjoys it, and as most of you know, she is very knowledgeable. So I am going to call Brenda in here so that we can chat with her for a minute to see how her treatment was and what she experienced. There she is.
Hello, Brenda.
Hi, Brenda.
So tell us, we've kind of gone through what the Vivace experience is, and tell us what your experience was.
It was very comfortable. Probably on a scale of 1 to 10, I would say its very worst was maybe a 2.
Okay.
It was comfortable through the whole experience. It was really exciting that probably 2 weeks after the treatment, somebody had said to me, "Your skin looks great. You have great skin." So I was excited about that, and it was after the Vivace treatment. So.
Oh, good. So immediately afterwards, were you a little bit red?
Slightly red, but you know, there was really, for the most part, the next day it was not red at all, and I came to work without makeup on, you know, a foundation or anything, and felt great.
Good.
Looked great.
Did you feel tightness for the next 24 hours? Did it feel like it was just a little bit tighter than normal?
You know, I didn't really notice that.
Okay.
No.
Did you notice any lifting?
Yes, absolutely.
Oh,
Yes.
that's great.
Yes, I am looking forward to, you know, the series of treatments to see what the total outcome is, and you know, we do take before and after pictures, so the proof is in the pictures.
Right. I love that. So would you recommend it for other people that are wanting a treatment that is effective, but not necessarily the downtime of some of the other more intense treatments?
Oh yeah, I'm so excited. Everybody that comes in, I tell them about our new treatment that we have to offer, and people are getting excited and already starting to book their appointments in their series of 3. So we're really excited about this new treatment, and especially since, you know, the before and afters are so visible.
Yes. And people are starting to, I think people were already taking advantage of the $450 introductory price for the treatment. It does go up to $600, so
exactly.
Hopefully people take advantage of that before the week's end. I see that you have your handy little Sharpay pen. Oh, I don't know if we can see it. That's the Vivace experience. No, they don't want us to look like this cute little Sharpay, so get your series and
iron out the wrinkles.
Iron out the wrinkles. That's right. I love it. Well, thanks, Brenda. I know you've got to get back to work, but we appreciate your insight. And certainly Brenda is here Tuesday through Friday to answer any of your questions. You can give her a call at 303-888-6426. and then you can always schedule a consult. Fortunately, we have two estheticians. We have Allison, who is not here today, but she is here tomorrow and Friday, and she and Alexa both perform this procedure. They are certified in the Vivace experience, and they are also happy to do consultations.
Absolutely.
We have so many different procedures and treatment options for our patients and our clients, and we're happy to offer that. And really our goal is to ultimately transform your skin. So we're on pass number 2, is that correct?
Yes, we are. Well, actually on the cheeks, this is our first pass.
Oh, it is. Okay, okay. How you doing, Jen?
I'm doing good.
Just a little red. You can see on her chin. Not too bad. So again, we have this special. The price goes up to $600 per treatment at the conclusion of the week. So right now we're offering it at an introductory price of $450. If you want to come in for a consultation, please do so. Like I said, we are happy to answer as many questions as we can over the phone, but we do like to see the condition of your skin if you haven't already been in to see us. We offer consultations Monday through Friday and 2 Saturdays a month. So do you have any closing remarks or suggestions for our guests out there, Alexa?
Just come in and get a consultation. As you said, there's so many other options that we can use, or modalities that we have to treat any skin issues. So a consultation is always a good thing.
All right, Facebook, we're gonna let Alexa get back to doing this treatment. We will definitely be posting before and after photos of Jen once we get through her treatments. And again, if you have any questions, comments, suggestions, anything, please feel free to comment. I know this video will remain live, or excuse me, not live, but will remain on our Facebook page. And we are happy to engage and answer any of those questions. So please come see us. We've got some fantastic estheticians here and providers performing treatments all day, every day. We are definitely your one-stop shop for all things skin. So we look forward to seeing you. Have a good day, Facebook.
Have a great day.
Bye.